Many people with ADHD achieve excellent relief with these drugs. Not all of them, but many of them do, especially if these treatments are started early in life. So now, knowing what these drugs are, I want to raise the question of why prescribe these drugs? I mean, everyone has to make a decision for themselves or for their child as to whether or not they're going to take these things or not. I also want to acknowledge that many people out there, many people out there, are taking these drugs even though they have not been clinically diagnosed with ADHD. And when I say these drugs, I'm specifically referring to Ritalin and Adderall and modafinil, but more typically it's Adderall. Okay? People using cocaine and amphetamine for recreational purposes, that's a completely different beast, and it is indeed a beast, and it's something that I strongly discourage. However, I am aware that up to 25% of college students and perhaps as many as 35% of all individuals between the ages of 17 and 30 are taking Adderall on a regular or semi-regular basis in order to work, in order to study, and in order to function and focus in their daily life, even though they have not been diagnosed with ADHD. There's a whole black market for this. They're getting it from people with prescriptions. I'm not here to pass judgment. I just want to emphasize how these drugs work, some of the things that they do to enhance cognition and focus that actually serve the brain well in certain individuals, and how they can be very detrimental in other individuals. I sort of blew right past it, but the fact that in upwards of 25% of young people are taking things like Adderall despite not having a clinical diagnosis of ADHD, well, that's a ridiculously high number. A few years ago, it was estimated that Adderall use and Ritalin use without diagnosis of ADHD was second in incident only to cannabis. But actually now, the consumption of Adderall without prescription is higher than the consumption of cannabis in that age group. So what that means is that there's a lot of stimulant use in that age group. And there are a lot of adults also using and abusing stimulants in order to gain focus.